Hello and welcome to our Foot Care Cafe. Today our topic is on common nail problems and what to do. My name is April. I am a foot care nurse and a licensed practical nurse in the Wolf Creek Primary Care Network, mainly out of Lacombe and Ponoka area. And this is Rachel. I will let her introduce herself and the PCN.
All right. Hey, everybody. My name is Rachel. I'm a registered nurse. I'm the foot care nurse for Rimbey with the Wolf Creek PCN. I've been working for almost a year here now, and I thoroughly enjoy it and love doing this virtual world that we're into now. Talking a little bit about the Wolf Creek Primary Care Network. It's one of 41 primary care networks in Alberta. Operating since 2008, it's been providing patients with greater access to primary care in the communities of Delburn, Lacombe, Innisfail, Sylvan Lake, Ponoka, Rimbey, and Bentley. With this addition of virtual programs and information, the Wolf Creek PCN may reach other communities as well. The Wolf Creek PCN has a vision and goal to increase the emphasis on health promotion, disease and injury prevention, care of medically complex patients, and care of patients with chronic disease. The team of family physicians, chronic disease case managers, registered dietitians, exercise specialists, psychologists, social workers, foot care nurses, LPNs, pharmacists, and panel managers all work together to improve and maximize the health of our patients in our communities. If you want to know more about specific programs and services, please visit the Wolf Creek PCN website. On there, you'll find other programs such as the Exercise Cafe, Happiness Basics, Diabetes Cafe. There's also some programs you can register in for anxiety to calm, moving on with persistent pain, and those just list a few of what is available to you on their website.
Awesome. Okay, so let's get started here. I'm going to share my screen with you. All right, so you can see here today our topic is common nail problems and what to do. And the two most common problems probably that us as foot care nurses see is toenail fungus. The other name is called onychomycosis, and of course ingrown toenail. Ouch. All right, we're going to continue here. All right. So fungal nail infection, onychomycosis. What are the signs of nail fungus? So brittle looking nails, very common. Sometimes it looks like there's debris trapped under the nail. Sometimes the nail demonstrates to be loose or lifting. Often there is some thickening of the nail or even crumbling edges. And quite often we will see white or yellow discoloring on the nail. Now, what are some of the reasons why people may get it? Well, they might have a minor skin or nail injury. They might have contact with an infected person or maybe they were sharing nail clippers, foot tools. They might have had a history of athlete's foot. Maybe they have excessive perspiration on their feet. Maybe they live in a warmer climate or moist environment. Sometimes wearing closed-toed shoes made of material that doesn't breathe, such as work boots, can cause or make toenail fungus flourish, okay? And another one is walking barefoot in damp areas such as swimming pools, maybe your home, and often hotel showers. And just a little FYI, 1 in 5 Canadians are affected by this. 1 in 3 people who have diabetes tend to have it as well. And individuals who are immunosuppressed are definitely more prone to it, unfortunately. So toenail fungus, what is it? It is an infection in the nail, and it can be quite difficult to get rid of, especially if it is fairly advanced. So please talk to your doctor if you think you may have it. There are different options, treatment options, both prescription and over the counter. Sometimes they may only be a little, slightly effective, but left untreated over the years, it definitely can get worse and can cause sores underneath the nail and often can cause ingrown toenail infections. So toenail fungus, don't ignore it, okay? Don't ignore it. You can see in these pictures here, it talks about, you know, the clinical presentations of the different stages, such as mild onychomycosis, moderate in the middle, and then severe onychomycosis on the right side. So mild generally starts on the big toe usually. It usually looks like it's just appearing white or yellow in the distal lateral corner of the nail. And then as it slowly progresses over the years or months, it slowly spreads throughout the nail, and then severe when it's left just alone to do its thing. We see thick yellowed nails, lots of debris looking, fungal has taken basically over the whole nail. And there is cases past the severe stage there that are very problematic because the nail gets soft secretly underneath it, and that's where we see the infections and problems occur. So if you think you might have some nail fungus, don't be embarrassed. It is common. Talk to your doctor. Get on it before it looks like this, okay? We want to avoid feet like this. Okay.
So there are some options for both a pill form of medication and also some topical, depending on how much nail involvement there is. If there's a small portion of your nail, some doctors might just want to prescribe you some topical solution to help battle the fungus. If there's quite a bit of your toenail or more than one toe involved, they might also go to an oral medication. So Penlac or Jublia are topical nail lacquers. You put it on once a day for a very, very long time, period of up to 48 weeks. It's cost efficient. It does take a while to see progression and improvement in the fungus. You apply it once a day to the affected nails and to the underside of the nail. When it's applied, this lacquer will interrupt the energy production and toxic degrading of the nail that the fungus produces. It's going to inhibit the fungus from taking up nutrients in the nail, and some skin irritation may happen. And Jublia, similar, same effective medication. Lamisil, Sporanox, Diflucan, or oral medications. Often you're taking it, the Lamisil and Sporanox is a daily pill for 12 weeks. Diflucan can be once a week for 6 to 9 months. Most of the medications that we deal with antifungals that you take orally, you need to have usually good kidneys, good liver function. So sometimes the doctor may be ordering you some blood work for baseline and also to see for the duration of treatment if it's having a negative effect on your body. Oftentimes we're going to see some nausea, vomiting, some stomach pains, maybe some diarrhea as some side effects to these medications. Now, if you choose not to go with official medications, there are some natural remedies that people have tried. You can apply tea tree oil twice a day to your nails that are affected. In the research that I saw, there was no big benefit for this treatment, but there was no harm. Vicks VapoRub, apply a small amount with a cotton swab daily. This did show some benefit in some studies, likely related to the active ingredients of eucalyptus oil, menthol, and camphor. Apple cider vinegar, a mixture of vinegar and warm water of a ratio of about 2 to 1 water to vinegar. For 15 minutes twice a day, you soak your feet. Vinegar being acidic will slow down the growth of the fungus, or it may kill the virus completely. But just know that this is persistent patient treatment that there's no quick fix for fungus. Keeping in mind buffing the nail down, thinning out that nail if it's quite thickened with a file, so the fungus has less of a home to be in. Also file down prior to putting on things like the Penlac or the Jublia if you were prescribed the lacquer. What else did I want to say? Don't wear old shoes that may harbor fungal spores. Making sure that once we get in the process of treating this fungus, to make sure you change your shoes out, because the fungus can be harboring its spores in our shoes. making sure we're always wearing dry socks, wearing sandals in public showers, pools, and locker rooms, and making sure that we're not sharing our clippers with our family members. If we do have to, making sure you're really trying to disinfect that clipper each time. Just know that toenail fungus does tend to come back even when there was some success at getting rid of it. It can be a lifelong problem, but making sure that we do some preventative steps, making sure you have good foot hygiene, and catching things early if things do creep back up again. So ingrown toenails occur when the edges of the nail grow into the skin and start to curl around. They cause pressure and pain along the nail edges. The edge of the nail may cut into the skin, causing redness, swelling, pain, drainage, and even infection. The most common causes of ingrown toenails are pressure from shoes being too tight, peeling toenails, cutting toenails too short, having a toenail deformity due to injury or fungus, or sometimes it can just be plain old genetics and it's completely out of your control. So these are some pictures of ingrown toenail. So the best way to avoid this situation is making sure we know how to properly trim our toenails. We'll talk about that on another Foot Care Cafe. Making sure that we're cutting them straight across and not cutting those corners down. Keeping any thickened nail file down to prevent pressure on the edges of our nail folds. No peeling the toenail off, and making sure we have proper fitting shoes. Making sure that the pressure on our toes isn't so great that it's pushing on that nail fold and causing more of that nail to grow into our skin. So it's not too late. If you do have an ingrown, what do? Soak in lukewarm Epsom salt water for about 10 minutes a day. Apply antibiotic ointment if there is showing to be signs of an infection. Wear comfortable shoes and socks. You can take an over-the-counter pain reliever, Tylenol or Advil, based on whatever other medications that you are on. The corner of the nail that's digging in needs to be trimmed to help that infection. Sometimes when we cut the corner of that nail, if you were doing it at home, you may have left a little bit of a bone or a nail spur that's growing up into the skin, and you need to get the rest of that nail clipped off. So that's where it's good to see a foot care nurse. You may need to get a nail brace to retrain that nail to grow back out more flat instead of curved. You may need to see a doctor and have a nail resection procedure done, where they take a section of this nail out that keeps curling under and causing you grief, and that can help correct it.
Awesome. Thanks for all that, Rachel. We hope you guys learned a few tips from us today. Thank you again for joining us, and we will have more topics available on our website, so please come and learn and get educated with us, okay? Thanks again. Have a great rest of your day.